Let's do it. So today we're going to talk a little bit about postpartum strength. With that, I didn't really put in postpartum strength training because strength comes in so many forms. What you just did as a mother is amazing, and that is strength within itself. So we'll get a little bit into that and what that entails in the entire presentation. But introducing ourselves, we got Dr. Greg, Dr. Matt, and myself, Dr. Anna, here at Thrive. It's a great community. We have a great mission here. As physical therapists, we're always striving to create, a good standard, but here especially, we're creating a new standard in healthcare through an extraordinary experience. This is truly healthcare reimagined, and until you kind of step in the doors, it might take people a little bit of time, but definitely if this is something that you're interested in and you enjoy this, we'll talk at the end of how to contact us, but this is a great place for a lot of people. And also, we're passionate about changing lives through movement. I think this view is especially true today as pre and postpartum experiences vary person to person. But there is information overload in the world and fear for many of causing harm to, either the baby or oneself prepartum. And then, more going into after pregnancy, I would just invite you to be open. There's different research views coming out today, and understanding our capabilities as humans, especially females, is evolving and evolving for the better. So with that, we'll talk a little bit about some anatomy, recovery timeframes, whether you did vaginal or C-section, breath work and relaxation, as that's kind of that precursor to really getting into movement and feeling good about your movement, and then just kind of wrap up. Getting to the anatomy, you can see that we have definitely different layers, a deep layer, superficial, and then just some attachments onto the pelvis. With that, you can read them all, long words, but really think of it from pubic to tailbone, so front to back. And then your ischial tube right here to ischial tube. So we have that lateral, and then we have kind of that front to back, and all those muscles are encompassing and attaching. There's 3 layers. Like I said, we have kind of that superficial, deep, and there's about 3 to 6 muscles in each layer, all working in concert together. They interplay, right, with what's around. So, these attachments with our adductors, our superficial deep gluteals, our hip rotators, and our iliopsoas that kind of attaches here and here. They're all in concert, like I said. So nothing is just, it's just this muscle or just that. When we walk, we move. When we do things, when we talk, muscles are moving. So just as food for thought. When we think about the functions of these muscles, you can kind of just see what it looks like of that kind of nice little hammock area. But the pelvic floor consists of muscles and connective tissues, ligaments, and fascia. So it's not just muscles. You can see back here that we do have, right, our ligaments, which are bone to bone. And then we have kind of the tendons of the muscles attaching. And that all forms that nice supportive sling that we see here. This closes and opens, right, to prevent leaking, to facilitate emptying, and overall support kind of our organs above. If you really think about it, we have a whole diaphragm and organs above that. So it does take a lot of pressure, and they do have to be strong. I also like to make just a note here, because we'll talk about it a little bit later, that these pelvic floor muscles are comprised of both type 1 and type 2 fibers, mostly type 1, so about 66%, but also type 2, which are those fast twitch. So they have to work quickly. And sometimes if we're not able to meet the demands, that is known by some things that might be happening with pelvic floor dysfunction. So when we get to the actual kind of thoughts of contraction, releasing, and what they do, they have a lot of jobs, right? I talked about it in the function slide of what these muscles are constantly doing on a day-to-day basis. But the best visual I can think of is kind of a trampoline. So if you think about your pelvis as that metal outer frame, and then the actual trampoline as the muscles, these muscles inside need to be pliable, and they need to give a little bit. They can't be extremely stiff, right? These kids, it looks like in this case, this trampoline is probably stiff. These kids are just flying up, but we want to make sure it's kind of that perfect where it can relax, it can contract, it doesn't have a lot of tone. that just right combo is super important here. So with that, when the muscles contract, right, they squeeze and lift, but they need to also kind of think about it in a way of responding to movement related load. So they also do kind of that anticipatory, when you're running or jumping or anything, they also have to anticipate and kind of react reflexively quickly. And that's when I was talking about we have different fiber types in there, but that's super important as well of the function of those muscles that they have to be really kind of quick when we get into more of those higher impact activities. So when we get into more of the birthing, we talk about kind of this bulging and you kind of that down and out to allow for that delivery. So when we think about recovery time frames, postpartum experiences are super unique, right? Some of us have never experienced it, and others have all just kind of a different path, and that uniqueness is awesome. Um, there's definitely different layers to that, and this is kind of a little bit more of a generalist view. So this is where we can like later on talk, like if you're someone that's experiencing a little bit of a different case, we are people that can work alongside you with your specific case. For some of you, this is maybe just a starting point that you want to try for some of these things, and it's going to maybe offer that relief and you're going to feel better. So with that, again, we're unique, but regardless, if you've had a vaginal or C-section, trauma has occurred. So with that, we need to respect the body and respect future longevity and the activities and movements that we're going to do in the future. So it's okay to take a little bit of time, right? Once you have a child. I like to say we don't need to just like next day be right in the gym, go, go, go. Even if you are that person, I personally am that type of person. And knowing that it is okay and giving yourself a little bit of grace is something that we all need to do. But definitely if you're that type of person that thinks immediately I have to go, right? Trauma's occurred. Let's give it a little bit of a rest and then we'll gradually rebuild so that we feel like we can get back to doing all the things that we love. With that, if you have an uncomplicated vaginal pregnancy, right, you can begin walking. Pelvic floor muscle exercises are awesome. With that being said, those exercises, can definitely be what we call a Kegel, but we like to just say kind of a pelvic floor contraction where you kind of just squeeze those muscles, hold and release, and we'll talk about it a little later. But also that entails doing a lot of the hip strengthening, right? So over time, like those muscles, as we're carrying a baby and then the baby comes out and then we get back to doing things, we want to make those muscles that we talked about way in the back, kind of here, that all attach, get strong again. So the glute muscles are going to be extremely important to get exercising with either a band or a little bit of load or maybe your body weight, doing a little bit of adductor squeezes with your pelvic floor, doing a little bit of hip flexor movement, right? All of that's important. And something that we should consider just right off the bat once everything starts happening. Don't wait on this, try to get it going, and then absolutely get some stretching in. If it feels good, it alleviates some symptoms. Sometimes that stretching always can come before movement because that helps pre-prep, gets the body feeling good, and then we can move better. If you have more of a C-section implication, right, there's a lot of different kind of guidelines to this, but really think of it in this framework of kind of the first few weeks, many people are able to resume light activity, household activities, kind of minimizing exerting a lot of force. Usually there is a weight restriction for some people. I don't know if they've always gotten that, but let's be honest, if that weight restriction is about 10 pounds or 15 pounds, sometimes as the baby grows and we're picking up things, it's just not realistic to our day-to-day scheme. So just know yourself, right? Just kind of avoid anything that's going to feel like it's exerting too much force that your body just can't take it on, because we do have this incision, right? And we want to make sure that heals appropriately. And if you're a little like nervous about that, you can always see, a therapist like myself, and then you can definitely see, other providers and like your OB-GYN or whoever else is kind of within that interdisciplinary unit. As we get forward, right, we want to think about kind of getting into like the later weeks. You're starting more of that low impact where, we're not as worried, but we still kind of have that incision and hernia risk. So we just want to keep, again, preservation of just seeing how the body's tolerating different movements, seeing how it responds, and then going from there. And then finally, usually about 12 weeks, we can get into more of those higher impact routines. At that 6 to 8 week mark, typically there is more of that medical clearance. So that will also be a good guide for yourself to feel like you can kind of get back to doing things and things are on the right track. I did also want to just kind of point out that, as we go forward and talk about a little bit more pelvic floor dysfunction, when you think about surgically, when you have to go through those layers of deep muscle, right? After any surgical implication, there's atrophy to the surrounding muscles, and this is going to still impact based on where it is, the bladder, the bowel, and sexual function. So, um, it's just good to think just because you had, it's not vaginal and there's not that specific trauma, that a C-section is trauma in itself to the pelvic floor and the pelvic floor musculature. So don't be surprised if some of these pelvic floor dysfunctions come up for you as well. It also can contribute to some low back and pelvic and hip pain. So again, we're kind of the go-to providers for helping you get back to some of those issues. And that's why I kind of have that plug, because when in doubt, talk to someone that's definitely been in this, field and is excited about it and ready to help you. So with that, we'll segue into the pelvic floor dysfunctions that we see. Pelvic floor, like I talked about before, it doesn't discriminate. You could have a C-section, you could have had a vaginal birth. It's an umbrella term. So it encompasses several diagnoses, some of which we'll just discuss in the following slides, some of which I did not entail in this. So first and foremost, this is a big, big, big thing. I'm in the CrossFit realm with a lot of moms postpartum that I'm seeing talk about their experience and still kind of experience some leaking today. And I would say we'll talk about it, but that's definitely abnormal if it's getting to a certain point, and we want to address that. So with stress incontinence, it's a big heavy hitter for a lot of postpartum moms, and it can linger. So you're 2.4 times more likely with a vaginal birth than a cesarean. But just remember, just because you didn't have a vaginal birth does not mean that the muscles around aren't weak and that you can't have this happen. So with that, where to start? I like to say, so if you're kind of laughing, sneezing, weightlifting, and you're experiencing kind of that urine loss because there's too much intra-abdominal pressure and your muscles just can't sustain it, or just they don't have the capacity yet, then we might see a little bit of leaking. So something to consider is start a bladder diary. When are you leaking or kind of going? How often, how much? All of this kind of matters, right? We want to take kind of a frame, maybe you're drinking certain things, like all of that can be bladder irritants too. Like we just want to be mindful of like, what does that look like in a 7-day period and what's kind of going on? Second, we want to think about being intentional with our intra-abdominal pressure. Like I talked about, when we sneeze, when we lift, when we laugh, our intra-abdominal pressure definitely goes up. So when we're managing that a little bit more appropriately, we can see that we can kind of relieve a little bit of that stress incontinence that's happening. It's kind of that first segue to see if this is making a difference. So engaging the core, right? This is not holding your breath. Not to say the Valsalva does not happen and it's completely wrong. I think we're going away from that research, but stacking the pelvis, so making sure that your hips are not extended backwards, trying to stack it and keep the core braced instead of just, again, tilting, can definitely help with some of that intra-abdominal pressure and minimize kind of that trigger that you might feel. And then finally, taking notes of the movements you're doing and making modifications. So doing something different, right? If it's the speed of movement, right? We talk about speed of recruitment of kind of those muscles. They don't have the capacity, and those muscles cannot quickly fire to hold when you're doing activities and the intra-abdominal pressure is high. Let's see if we can change what we're doing something different, if that changes the scheme. If it does, that's maybe where we start, and then we slowly kind of progress from there. Also, I think it's just important to understand that the pelvic floor muscles, like I said, are different. They have different fiber types. So that all does matter to what type of movements we are doing. And so that's why I think about doing something different can help us eventually, again, progress. Second, if you have stress incontinence, urinary incontinence, you may try to manage this by, restricting your fluid intake and frequently emptying your bladder before or during training. but this can result in developing urinary frequency. So now we have turned into kind of that urge incontinence. So I talk about this Pavlovian response, or that key in the lock. Anytime that, you get home and you turn the key and you're like, I have to immediately go to the bathroom, we're starting to send signals to our brain to tell us like that's what we should do. And we want to try to work on minimizing that, especially if you've created this maladaptive behavior when you were doing your stress incontinence because you were worried about leakage, and now you started going a little bit sooner or trying to relieve that. We can now get into a little bit more urge. So with that, I want you to just kind of like think about what are ways that we can, start to minimize. And the first thing, and kind of that tip to aid or maybe avoid or take control of the situation, is to first stop. I like to say give it a squeeze. So squeeze the pelvic floor, right? Draw it up and in, decrease that bladder activity, and then try to distract yourself with something and kind of calmly proceed to your task. Or if you do have to go to the toilet, but you don't want to make it feel like it's always a rush, right? Take control of your life. Because at the end of the day, in both cases, it's super important to say we need to denormalize leaking. Like, you shouldn't be getting to a certain point and saying, I'm still always going. This is huge, because if I told you every time you did an activity you had pain, you wouldn't like that. And that's the same approach we have to take to leakage, that if every time you did this you had pain, or if I term leaking, we have to say that's not okay anymore, and we have to help people out. Another one is going to be our dyspareunia, with 40% reporting painful sex 3 months postpartum and 20% at 6 months. This is definitely, important. I think as physical therapists, sometimes we shy away from these things, but it's important. This is, people's lives, and you want to make sure that they can do all the things that they want. So when this happens, a lot of the time, it could be a little bit more based on if you had like a vacuum assisted delivery, forceps delivery, or any perineal lacerations. This could be a little bit more prolonged for you. But again, a lot of people are being impacted by this. And it definitely is not only physical, but it impacts our mental health. So although this can be multifactorial, and we'll talk about, the source may not just always be physical trauma too. So we have to also consider the thing between our ears, which is our brain, right? When we create these patterns of when we're worrying or when pain starts to happen, it kind of starts this trend where every time that activity happens, we're nervous about pain. The brain starts signaling, and that could definitely be an integral role into this. So just to consider where to start with it is you can definitely do some external work. So myofascial releasing around the abdomens, the glutes, the adductors, all could be a starting point, whether you do a foam roller, maybe a lacrosse ball. If this isn't kind of solving it, there's definitely a lot to say that there might be more of an internal piece to this, which we kind of discussed prior, of like all those other, muscles that are inside that we have to look at. So PTs do acquire a special continuing education in order to perform this. And I do not currently have that. And that is why there is definitely, you want to find someone that is going to be like a good referral, or we have kind of good referral sources, or someone that you know of that supports what you're doing and can help you aid in that internal assessment to make sure everything is looking good. If there's anything that needs to be worked on there, that's important, because within the internal exam, we kind of use tools and other things. So it would be important to address. Also, talking about the brain, neuro re-education. So by downtraining your nervous system, by being mindful, meditating, breath work, it's all easy to say because we say it a lot, but actually doing it and putting a little bit of time and attention, 5 minutes here and there, could go a long way, right? Calming the nervous system, helping it be less heightened and excited, can help kind of reinforce those driving pain signals that you're experiencing. But like I talked about with these 3 big heavy hitters that we're talking about with pelvic floor dysfunction, like urinary incontinence, if it isn't resolved, and they say about 6 months, seeing a pelvic floor therapist is really important, because it likely won't resolve on its own. Kind of the other big one, and some people have experienced this, some people have not, is pelvic organ prolapse. We're going to discuss it where we're thinking about these organs within the pelvis, whether it's the bladder, the uterus, or the rectum. begin sliding down, and this is kind of a good visual picture, into the vagina. And then due to the weakness of your musculature or the tissues, right, that hammock or support, that is why we're having that happen, right? It's sliding down because we do not have that support. We need to start building it up. So thinking about that, there is a conservative approach. Dr. Jessica Gingrich, who works with the Institute of Clinical Excellence, which is an awesome resource if you guys are looking kind of at their pelvic floor division, and some of their therapists that support that. They have great research out there now about this stuff, but she discussed kind of approaches to finding relief and working your way back to starting. And it starts with kind of that pelvic floor. It's simple, but working on the contraction, that Kegel, which, you know, sometimes it gives a bad rep, but it is useful. So starting there, getting that hip strengthening that we talked about early, even when you have that uncomplicated vaginal birth, right? We're getting right to it because this can help kind of alleviate potentially that pelvic organ prolapse in the future. And then we're getting into kind of working on that core bracing, not holding your breath, right? I should be able to brace my core as I'm doing now and talking to everybody, right? I'm just able to like turn that on and turn it off, and that's important. And then also loading that core over time. So we need to also deload to then eventually reload to increase the capacity in different positions. So if there's certain positions that irritate and you're dealing with pelvic organ prolapse, right, you want to decrease first the symptom irritability, and then you can slowly kind of work your way back, right? This is kind of a little bit of an investigation on your own, but just know if you're decreasing that symptom, it's a really good find. You're saying this is a good activity for me to do. It doesn't heighten my symptoms, and then we can eventually load it, and over time our body will adapt. Sometimes a surgical option may be necessary, and that's something that you would talk with either your therapist, physical therapist further with if things aren't resolving, or you could talk to somebody that is within the field of kind of that postpartum specialty. The other two things that we're going to just discuss with the recovery bundle is constipation and diastasis rectus, because they're very prevalent for people, and you're not alone if you've experienced it. So first, it's important to keep in mind due to the fact that if you're constipated, this can also kind of segue back to urinary incontinence. So it can lead to a neurogenic bladder, right? If we're having a little bit of kind of that colon pressing on the bladder, it can definitely start to kind of irritate that bladder. And then we have contraction happening because of that pressure. Or over time, maybe the bladder might not fill or empty appropriately. So addressing this early and soon is very important. Helpful solutions, toilet posture. If you haven't had one yet, I think personally, I love it. The squatty potty. If you see this, we have this puborectalis muscle. And when we are elevating our feet, right, we can kind of take what feels like it's tight and we can kind of relax it. So it usually can help. So that's kind of that toilet posture of where we're putting our feet can be definitely beneficial. If not, working on a little bit of breath work and relaxation. Again, it's coming up again and again. We don't do it enough in our lives because we're always on the go. Sometimes doing that and getting that parasympathetic nervous system into play is huge, right? Rest and digest, that can all help with that constipation. Hydrate, especially if you're breastfeeding. This is so important, right? Get your fluid in, make sure you're hydrating. This can help. And then the final one is our fiber. So plenty of things here, but you know, apples, avocados, lentils, whole grains, nuts, almonds, potatoes with the skin, you name it, getting a little bit of that fiber in, broccoli, right? Sometimes we don't even think about some of the things like vegetables that have that. Get it in. It can definitely help because as you can see statistically up here, 49% at 1 week and about 28% at 8 weeks, even postpartum, are experiencing constipation. And then this is another really big kind of topic of debate for a lot of people, but diastasis rectus is basically this thinning or widening of your linea alba. You can see that there's definitely different portions as we run that line up and down. Everybody experiences it a little bit differently, but it happens when we are pregnant because we need to accommodate a baby. So everybody really kind of experiences this. And then afterwards, postpartum is when we want to work on having that body heal and manage it early on so that you don't have it kind of prolonged later on. So with that, if you think about it here, increased abdominal pressure, that intra-abdominal pressure that we talked about previously, and decreasing that abdominal engagement, you'll start to see maybe a coning, doming, or bulging if you kind of look up here. That's your signal to say your muscles right now are just a little bit too weak. I don't want you to fear movement. I don't want you to not do anything, because we still need to start loading these muscles to get them like ready to go and build that capacity, but we just need to draw awareness. So staying functional, flexing is okay, rotating is okay. You know, but just watching for these signs and these symptoms of kind of that coning, doming, and bulging just shows that you're just not engaging your abs well in whatever movement that is. So find out what works and that still allows you to kind of work on that muscle engagement. And that's how you can kind of continue to rebuild that capacity. So it's just scaling back for a little bit. Once it's starting, you can go back to the activity, see if it starts presenting it again. If not, maybe it's showing that you're building that capacity again. So again, don't fear movement, move and see if you're experiencing some of this, because we're just having some of that weakness. Now we'll get into, as we kind of did talk a little bit about, what are ways to help with some of those pelvic floor dysfunctions or those other kind of big heavy hitters going on postpartum. But when we really get into kind of the idea of movement, we want to think about breath work and relaxation first and foremost, because it's key for many reasons, right? We know that it engages your parasympathetic nervous system. So we're not always in that fight or flight, which a lot of times we might be, right? We're really stressed, dealing with a lot of things postpartum with our lives, right? Now dealing with kind of like managing another human, which is maybe potentially other children in the process. So that heightening that stress can definitely play a huge role in a lot of the symptoms that you might be feeling. And you might even find relief just by working on a little bit of breath work and relaxation. So not only does it, again, help engage the parasympathetic nervous system, but it also normalizes your pelvic floor muscles. So kind of contracting and relaxing helps that optimal function and helps them move, because we can't always have the muscles be on high alert all the time, right? We have to let them know how to reset, because they're always on high demand throughout the day. So doing this is definitely being proactive for it. It's also key because at times, your pelvic floors might be, like I said, more tight than they are weak. So we always think that we have weakness in our pelvic floor, and that's why we're experiencing all the dysfunction or the pelvic floor dysfunction. But truly, if we have tight muscles, and that's kind of why that internal exam is so important sometimes, that hypertonicity can actually decrease your circulation, create that localized hypoxia and ischemia, and that can be that result of pain that you're experiencing. So it's not always weak. Just understand that sometimes it can be tight, and breath work and relaxation can be that first step. So just kind of a practice type activity that you can do on your own is, de-stress, help normalize the muscle tone, and work on the intra-abdominal pressure management by starting here, where you're going to just put your hands kind of on that pelvic region to start. You're going to do an inhale, and this is sometimes hard because we don't even think of how we breathe in the day, and this is why it's such a good mindfulness activity for like 3-5 minutes, is putting your hands on that pelvis and then inhaling into those hands so that you almost feel something pressing out into your hands. You'll exhale slowly, and then as you exhale, where you're going to try to draw that pelvic floor contraction up. So it's even hard for me to distinguish how I'm breathing through that, but if you're mindful of thinking those 3 steps, it'll be great. You can start there for a couple minutes, and then you can put your hands on your lower abdominal region and then do that same activity. See if any of this makes a difference, right? It could be definitely a starting point before then we engage into kind of that movement brainstorming of what's appropriate, what's not. The reason we discussed, again, that breath work is just the usefulness and benefit it can bring. And especially as we move into a little bit more faster movements and lifting weights, especially if you're a big weightlifter or CrossFitter, we have a lot of higher intra-abdominal pressures. And so we just have to learn how to manage these movements, and we'll talk a little bit more. But something to consider is athletes may present with stronger pelvic floor muscles compared to non-athletes, but their muscles may still be too weak or respond too slowly to counteract the intra-abdominal pressure changes during strenuous activities. So just because you're a super strong person doesn't mean that the pelvic floor just based on everything that has happened, is just not ready for things. So don't beat yourself up about that. We started with a little breathing. We're transitioning to, I talked about that you can draw in and you can add that Kegel or that pelvic floor contraction to your breathing, but they're synonymous, right? Kegel, pelvic floor contraction. This is the place to start. So when you're thinking about adding this into your routine, it can help, reintroduce the brain body connection to your muscles. You can do different types of different types of kind of that pelvic floor contraction where you're doing kind of a rapid, quick maximum contraction, that quick flick. So we're targeting a little bit more of those fast twitch fibers. And then you can also do those long sustained holds. Progress this into different positions. So start lying down, do breath work on engaging it, do quick flicks, do sustained holds. Try this in sitting, try this in standing, try this when you're lifting, right? Or doing maybe different loads in your regime if you're going back to the gym. Do this in a gymnastic skill. I know for a lot of CrossFitters, you're doing stuff like kipping pull-ups. That's important, right? We want to be able to control all these factors. And the more that we address it with learning our brain body connection, the more it will become second nature. I know it's hard now, but if we just put it in the routine, it's going to make a difference. But this is not the end all be all. And so I always write the and then, right? Once we do breath work, once we do a little bit of that Kegel, and then we're getting back into engaging in kind of that sport or the activity that we love. Side note, if you're engaging in sport while pregnant, this does increase the odds of returning to sport postpartum. So don't stop when you're pregnant, right? Sometimes people are a little bit worried. Yes, you have a little bit of a different path than other people, and that's okay. But standard, if you can keep doing things, keep doing them. So as we continue to retain our body's tolerance to strength, training cardiovascular fitness, you won't be running, jumping, or lifting at the same level as you were at your peak fitness or crushing, your personal best right away. And don't, again, give yourself grace. Don't be too hard, but that's okay, because I like to tell everybody, whether people have a knee injury or back injury or shoulder injury, right? You had an injury to your abdominal area or that pelvic region. And we have different seasons of our life, right? So we can get ourselves back to it. It's just frustrating because I know it's this time period that we don't have, but we'll get back to it. And that's why coming to kind of like a physical therapist who really loves kind of that postpartum and can fit your needs is important, because we can kind of uplift you and help you get back to those things. So when you start that exercise program, a little tip that I thought about is kind of first begin a 15-minute of moderate activity. So warm up, of course, 5-10 minutes just to get some blood flowing, nice and easy. And if you are not experiencing really any fatigue, leakage, pain, and that's all managed well the next day and the following day and so on, then start increasing about 5 minutes. See if that makes a difference each week, not each day, but each week. When we're thinking about moderate activity, I just want you to keep in mind, we don't always have a heart rate monitor on, and sometimes they're not super accurate. So 70% max heart rate, right? If you're at, 6, 7 out of 10 on that kind of exhausted feeling, I think that's kind of that, like, where you're pushing that pace. That's kind of where I want you to be. It should not be a max effort 10 out of 10, 9 or 8. It should just be kind of like you're able to sustain it for a little bit longer durations of those minutes, and then we'll kind of progress from there. And then I like to say that the largest issue seen in women, not reaping the health benefits of regular physical activity tends to be because of incontinence, pain, fatigue, and heaviness that we talked about. So that's why we do want to address those things early on, so that you feel like you're ready and feel like you're getting more primed to get back to some of those activities you love. Just altering your sporting habits by reducing exposure to the high impact activities or the time spent performing the sport may reduce your symptoms initially of your pelvic floor dysfunction. But, that modification is definitely different for each person and where they are at. So you versus another person, again, is very variable on how you can progress. You might see people, and studies have come out where people are running at 4 weeks. Some people say, let's do it at 12. I like to say, I've listened to a podcast, runners will run. So we're seeing, like, again, early on that people are going after it a little bit sooner than we thought was expected. And they're actually having good outcomes. They're, staying safe, feeling good. Because people just don't want to stop what they're doing. And I think as we as PTs especially need to kind of come alongside the individuals and help them, understand their capacity and what they're bringing to the table, versus kind of just shutting the door and saying, hey, at 12 weeks, that's when you can do this, right? People want to get back to things. We got to help you out. So increasing that load, again, using what I talked about here about kind of fatigue, leakage, pain being managed. If that's going well, keep doing it. This is not meaning you're doing a 3-5 mile right off the bat. You can even just start right in an easy spot where you're 15 seconds of running, right? Those nice intervals, and then 30 seconds of walking. See how you tolerate the next day and then kind of increase from there. And this is great here. So if you're somebody that does really like to weightlift, or you're in kind of that CrossFit realm, at the 4, 8, and 12 weeks, as we kind of span it along, so 1, 2, and 3 months postpartum, you really want to consider your stimulus of your workout, your exercise history, your recovery, and your goals. So again, everybody's on a different spectrum here. I think a lot of times postpartum, we hide ourselves away a little bit, and not just because we're busy. I get that. Like, that's a whole different barrier, but we're nervous. So we don't go in, we don't see our friends, we don't have that activity. And I think that hurts our mental health a little bit. So this is just an idea of, you can get into some of those classes, especially a CrossFit, and the coach can absolutely help, you work on kind of having your own stimulus of the workout with remaining kind of safe and feeling comfortable within your body. So when you're modifying each month based on kind of that stimulus of the workouts, just listen to your body for your feelings of heaviness, fatigue, leakage, and pain. There's so many ways and variations to modify things to keep you moving and keep you, feeling mentally happy and upbeat, that, is so important holistically. So I don't want you to stop doing it, basically. I don't want you to stop doing what you love just because you're scared. Talk to the right people and we can get you back to doing those things. Towards the end, I just wanted to say that there's definitely some barriers. I get it, right? You're breastfeeding, there's lack of sleep, you're recovering from birth, and they're just all a few of the significant considerations as you're healing from, again, this traumatic event. It's not traumatic in the sense that you have an awesome child in your arms and stuff, but it's still something that happened to you, and it's still an injury to the body. So, considerations that, impact healing and kind of your exercise readiness is important. And all of that, again, your feelings towards it can be barriers, but any movement is better than no movement. I think, in the world we live in today, movement is way less than it should be. So if we can just do the little things each day, even if it's not, what you were at before, it's going to matter in the long run. So, and not even just matter for postpartum, but chronic disease management and things as you go forward into your old age, bone density, as you get into premenopausal and postmenopausal, the list goes on and on. So with that, if anything, with somebody that you could do, incorporate your child with, right? That's easy. Take the kid and, enjoy some movement together. It can definitely be a good bonding experience. And then I like to say progress, not perfection, right? So some takeaways here is you have intention now for your intensity later. The larger the base, right? When we talk about the breathing and pelvic floor musculature getting stronger, and then starting to, run, lift, strength train, all of that creates kind of that base initially to that peak of that strength training, giving back to your kind of personal records and your, the things that you're looking forward to with your loading or the weights that you used to do, but you feel like you can't do. All of that's going to get you higher to that peak. Improving resilience to be able to cope in all sorts of ranges, motions, loads, speeds, and forms of activity is important, right? We need to train our body to be resilient in so many ways, not just only for injury prevention, but again, an injury just occurred. So like that type of injury, we need to do the same type of same type of motto in respect to it, and get our body primed and ready to go, because maybe you will be seeing yourself having another child later on, or maybe you just had you're kind of done. Either way, we need to kind of strength train and get ourselves back to doing those things that we love. Don't stay hidden away. With that, I'd also like to say that we, again, have a lack of movement problem. So in society, especially. So when in doubt, just reach out to a professional. Many physical therapists are fitness forward, but also educated in female and postpartum care. Don't, again, hide yourself away just because you're nervous. You absolutely have people that can kind of hold your hand and help you alongside in the process. Here's just some good references. At the end, I'm kind of highlighting here the Institute of Clinical Excellence. They're awesome. If you follow them on anything social media, you have Dr. Christina Previtt, Ellison Melrose, Jessica Gingrich, and Alexis Morgan, and all of them I kind of follow along and see what they're talking about. They have new research all the time, breaking some of those stigmas. They do a great job, and a lot of them are parents themselves, so they can absolutely understand what you might be going through. So just people to think about. Also, to like to give a little highlight, when I was in PT school, Dr. Catherine Shepard with New Normal Physical Therapy. She's awesome, especially in that internal exam. So just a shout out to her if you're ever looking to kind of find out if it's just not on the outside, but we need to kind of look a little bit deeper. We need to pair that with some of the other stuff that our physical therapist that maybe we're already seeing is doing. She's a great option for, again, that kind of internal and pelvic floor assessment. And then have this here if you want to scan it. We always have discovery visits here, which is just a nice free visit to get to know you, see what's going on, see if we can be of service. And I think regarding your postpartum, I'd love to, get people feeling confident getting back to doing what they love. So you can always schedule that with me. And then here's our info as well and my email to just, send it my way if you are in need. All right.